Do you suspect that your child had a brain injury at birth? Hi, I'm Frank Spector, birth injury lawyer in Maryland and DC for over 30 years. In this video, I'd like to discuss with you what are the signs and symptoms that you can tell to decide whether your child has been injured by medical malpractice at birth. First is that usually there is a traumatic delivery. In most cases, there will be an emergency C-section because there are problems with the baby during the delivery process. At birth, your baby may have these following signs or symptoms. The baby may be floppy at birth. The baby may be blue. The baby may require resuscitation. It's common that they're going to have to call in other doctors to come in right away to provide your baby with oxygen because your baby has been damaged during the birth process and has had a lack of oxygen, which is responsible for causing the injury to the child, causing the floppiness and blueness at birth. Afterwards, the baby will be taken to the intensive care unit. That's commonly referred to as the NICU, and that stands for the Neonatal Intensive Care Unit. And that's where babies are taken who have suffered an injury at birth. Your baby may also suffer seizures or tremors because of the lack of oxygen to the brain. When the brain is damaged, the body responds by having seizures and tremors. There may also be evidence of brain damage on an MRI or CAT scan of the brain. The doctors will take a CT scan or MRI of the brain, and they will be able to determine whether or not there has been areas of the brain that have been affected by a lack of oxygen to the brain, which resulted from the traumatic delivery. After a few days, your baby will not respond the way other babies do. Your baby will not be able to come home with you after 2 or 3 days. It's common that a baby will have to stay in the NICU for days or perhaps even weeks. Afterwards, your baby may have trouble walking, talking, seeing, or hearing. Your baby may also have developmental delays. Although they will be able to walk and talk, they won't be able to do it at the appropriate times. Your child, as they get older, may have problems learning in school, doing math, reading, and being able to do the activities of daily living, taking care of themselves, washing, bathing, and grooming. So if you suspect that your child has been injured at birth due to medical malpractice, please contact me below. I will be able to talk with you personally to ask you all these questions and to be able to tell you whether or not your child's injuries are as a result of medical malpractice at birth.